Good evening everyone. My name is Dr. Shaminder Singh, Junior Resident from Department of Pulmonary Medicine, GMC Patiala. My topic for today's presentation is Navigating the Nexus, Weight Radiology and BMI in Tuberculosis Therapy Outcomes. Tuberculosis caused by Mycobacterium tuberculosis stands as one of the deadliest communicable diseases globally. Its primary manifestation is pulmonary involvement. Many researchers have established a link between active TB development and malnutrition. Malnutrition has the potential to suppress T lymphocyte proliferation and hence hindering cell-mediated immunity, leaving the host more susceptible to tuberculosis infection. Weight loss at TB diagnosis is a risk factor, while weight gain during the treatment indicates treatment efficacy. The aim of the study was to explore the correlation in radiological outcomes, body mass index, and weight fluctuations in pulmonary TB patients. It was a prospective cohort study comprising of 110 patients aged over 18 years diagnosed with pulmonary tuberculosis on both microbiological and clinical radiological basis. Clinical and radiological evaluations with body mass index and weight measurements were made at initiation of ATT, at 3 months of ATT, and after completion of ATT at 6 months. Pregnant females and drug-resistant cases were excluded from the study. In this table, we can see that at initiation of ATT, the average body mass index of the patients were 16.47 kg per meter square, while at completion of ATT, it rose up to 19.11 kg per meter square. The average weight of the patient at initiation of ATT was 42 kgs, which rose up to 48.74 kgs at completion of ATT. In this table, we can see that out of total 110 patients, at end of 3 months of ATT, 101 patients gained weight, while at end of 6 months of ATT, 106 patients gained weight. In this table, we can see that the patients with better radiological outcomes had better mean weight as compared to the patients with poorer outcomes on the chest X-rays after completion of ATT. In our study, the patients between age group of 30 to 40 years gained maximum weight, that is 12% as compared to initiation of ATT, while patients in age group of more than 70 years gained minimum weight, that is 7.98% as compared to initiation of ATT. At 3 months of ATT, 91.81% of the participants had weight gain, while 4.55% individuals experienced weight loss and 3.64% individuals maintained stable weight during the ATT. At 6 months of that is completion of ATT, 96% of the participants had weight gain as compared to initiation of ATT, and 0.91% patients experienced weight loss and 2.73% maintained stable weight. Wasting is a prominent characteristic of tuberculosis and a contributing factor to disease severity and outcome. It is partially attributed to increased expression of plasma peptide YY, leading to reduced appetite. Weight loss is also attributed to bacterial endotoxins in TB due to dehydration from decreased water intake and anabolic block causing poor response to food intake. ATT had a pronounced positive factor on BMI and weight, indicating its therapeutic efficacy. Weight gain during the treatment correlates with favorable outcomes. TB patients should be advised to maintain a balanced diet, encouraging the cultivation of kitchen gardens for fresh seasonal produce. Collaboration with government agencies, social welfare departments, public distribution systems, agriculture department, NGOs and philanthropists can bolster nutrition support. PM Nikshay Poshan Yojana, Nikshay Mitra and nutrition app by the government are the commendable steps toward TB patients' nutritional welfare. The patient adoption policy under Nikshay Poshan Yojana effectively uplifts the nutrition of TB patients, leading to improved prognosis. And then we would like to express our sincere gratitude to the participants who took part in the study and generously shared their personal health information with us. We also extend our thanks to the healthcare professionals who assisted with patient recruitment and data collection.
Thank you. I have two suitable queries. Number one, see how much you can depend upon the weight gain, you see, as far as the efficacy of a treatment is concerned. I've seen a lot of patients, they don't put on weight, but if clinically if they are alright, the fever is not there, the cough is not there, and the general well-being is there. So see how much you can depend upon your weight gain all the time.
Sir, in our study, we have compared the weight gain with the radiological clearance. So the patients with the better radiological outcomes, the clearance of opacity, heterogeneous opacities on chest X-ray were found to have better average weight than the patients with poorer radiological outcomes.
The other thing is, you see, extrapulmonary tuberculosis. You just mentioned tuberculosis, and then again you said pulmonary. Because extrapulmonary tuberculosis probably behaves differently than the pulmonary tuberculosis. I've seen a lot of patients with they still don't lose weight, still have this tuberculosis. And then again, you see the weight gain or weight loss again doesn't come into that picture, you see, to justify our efficacy of ATT treatment.
Sir, in our study, we have only included pulmonary tuberculosis patients.
What heading was tuberculosis? In conclusion.
So, okay, tell me one thing. What do you expect when you treat a pulmonary tuberculosis or any tuberculosis case? According to your title, please go to the title. Yeah, navigating nexus, weight, radiology and BMI in tuberculosis therapy outcomes, right?
Yes.
So if you treat a tuberculosis case, take pulmonary tuberculosis, what do you expect? With treatment, radiological improvement is there or not?
Yes, sir.
It is there. Weight gain may or may not be there depending upon comorbidities, because you have not mentioned that how many pulmonary tuberculosis patients were diabetic, malnourished to start with, or any other comorbidities like inflammatory bowel disease or nutritional status. You have not mentioned.
Yes.
So even if you don't mention, generally we expect weight gain with tuberculosis treatment.
Yes.
So what new you are getting out of this study? They are established facts. For any problem, for any disease, if we treat, we find improvement in the investigational parameters as well as general well-being as well as health of the patient. Right?
Yes.
So what new inference your study is driving or contradicting or supporting things? These are well established facts. So yesterday also I was telling the students, go for the study to contradict the established facts or do something new. If a patient comes to me with weight of 40 kg and patient is, tubercular patient, I treat. Next month it will be 42. So we are expecting that. Right?
Right.
So yeah, study, I don't know whether you discuss the title of the study with your guides or, senior teachers, that what is happening?
Sir, actually in this study we have compared the weight gain in relation to radiological outcomes.
That is what I am asking you. What do you expect to radiological status with ATT? What do you expect? Worsening, stable or improvement?
Improvement.
Improvement. What do you expect for the health status with ATT? Worsening, stable or improvement?
Improvement.
If both things are going to improve and these are established fact, why compare? That is my point. So we need to do, yesterday only one paper on COVID was good, because that is going to give us insight of different mechanisms. Right? So please try to do something new. आप इसको गूगल में डाल के देखो कि established facts क्या क्या है. आपके पास तो जेब में किताब है यार. हमारे ज़माने में तो नेशनल लाइब्रेरी में लिखना पड़ता था, 1 महीने बाद आता था, फिर हम रेफरेंस फिर भेजते थे. It used to take 6 months to write a paper. Now you can write a paper in 6 hours. So go to the research engine and ask what is the nexus between radiology, weight and BMI. They are going to tell you. AI लगाओगे तो वो पूछेगा कि what a foolish question. Everybody is expecting improvement. Why do you are going to study these facts? Right? तो थोड़ा सा यार यंग बंदे हो, आपके दिमाग में तो आनी चाहिए new ideas. So those ideas should be encouraged.
When Dr. Vitull said, you see, from 40 to 42 kg, suppose it doesn't increase. So I mean, where we stand? That means our treatment is not efficacious?
So that can be attributed to various comorbidities.
Yeah, that's why we have not mentioned that. That means only weight gain, your nexus, you see, doesn't prove anything, you see. What is the established fact?
Dr. Shaminder, your 4% of your patients lost weight.
Yes.
What was their X-ray picture? Did it show no improvement or? Isn't it 4% you mentioned they lost weight?
Sir, actually, the patients who had bilaterally extensive involvement in their X-rays, their weight gain was poorer.
They lost weight also, I think. 4% you mentioned.
Sir, 0.91% of patients lost weight.
Okay. So they were further considered for the resistant tuberculosis?
Yes, sir, they were taken up for the bacteriological status of the patient under CB9.
Okay, thank you.
Okay, thank you.
Thank you, sir. The next presentation will be by Dr. Steffi Girl from GMC Patiala.
Good morning, everyone. I am Dr. Steffi Garg, Junior Resident from the Department of Pulmonary Medicine, GMC Patiala. My topic of presentation is Beyond the Cure, the Hidden Pulmonary Aftermath of Pulmonary Tuberculosis.